and welcome to the Mastering Your Fertility YouTube channel. I'm Kristin Cornett, and this is Dr. Haylee Nye, and we're the creators of the online fertility platform, Tiny Feet. Our business is all about helping women reclaim their health, enhance their fertility, and prepare for a healthy pregnancy. So today we're going to be talking about how to choose the right prenatal vitamin for you. And this is something that we recommend starting at least 3 to 4 months before you start trying to conceive. It's extremely important to supporting your fertility and building a healthy baby during pregnancy. But before we get started, we want to talk to you about a free resource that we created specifically to help you choose all of the right supplements during preconception and pregnancy. And that's a free course. So you can find that in the link to this video in the video description. And that's going to be called How to Choose the Best Prenatal Supplements. And it goes over the 6 essential nutrients, including a prenatal vitamin, that we recommend starting during preconception to support your fertility and your pregnancy. So we're going to get started, and Dr. Haylee is going to start by telling us why taking a prenatal before conceiving is so important.
All right, so taking a prenatal before conceiving is important because it's going to provide all the essential nutrients that you need to build a healthy baby, and you want to do that before pregnancy, like Kristin was saying. And you want to do that in addition to a nutritious, healthy diet. But it's well known that you can't get all of your essential nutrients just from diet alone because of many reasons, and so that's why we recommend a prenatal vitamin. And there's a lot of scientific studies that have shown that a prenatal vitamin can help with infertility, with pregnancy complications, reducing neural tube defects, and then also reducing the risk of autism in your child later. So very important reasons, but not all prenatal vitamins are created equal. And so we're going to, in this video, talk to you about the essential nutrients that make a big difference when choosing a prenatal vitamin. So we're going to start off by talking about folate.
Okay, so you've probably heard that you need to be taking folic acid in your prenatal to prevent neural tube defects in your baby. Well, that's not the whole story, actually. So folic acid is the synthetic version of vitamin B9, but it's not the most active or biologically available form of folate, which is what your body and your baby actually need. So we recommend taking a prenatal vitamin that includes an active form of folate to make sure that you're actually getting the right form that your body can actually use, and that will be most effective in preventing neural tube defects in your baby. We also want to mention that there about 50 to 60% of the population has a genetic variant or mutation called MTHFR, and this actually changes the way that your body processes folate. So you don't, those people don't have the same ability to convert synthetic folic acid into active folate. So the bottom line here is that we recommend a prenatal that contains an active form of folate, and that's going to be either L-methylfolate, L5-MTHF, metafolin, you might see it as quadrafolic as well on a label, or folinic acid, not folic, but folinic acid. And this is also an active form as well that you can use in your prenatal.
All right, so the next vitamin that we want to talk about is B12. This is a very essential vitamin to growing a healthy baby, and it goes hand in hand with using it with folate to be able to do a lot of things in the body that's very important, such as methylation, the formation of your body or your baby's nervous system. And it's also very important to be able to build up your B12 stores before you get pregnant because it assists in a successful conception. So it helps with pregnancy. A lot of studies have shown that even in IVF, that it helps with the success rates, and it reduces your risk of miscarriage. So lots of good reasons to add B12 into your supplement regimen and making sure that you have enough in your prenatal vitamin. Now, there is a synthetic form of B12 called cyanocobalamin, and then there's biologically active forms of B12 called methylcobalamin, adenosylcobalamin, and also hydroxycobalamin. So we're suggesting that you go for the biologically active forms of B12 and not cyanocobalamin, which is often found in a lot of the lower quality prenatal vitamins that you'll see on the shelves. Now, most prenatal vitamins contain only the recommended daily allowance of B12, which is actually set too low. Recent studies have shown that the amount of B12 that we need is actually higher than that. And now that we're learning more about SNPs, such as MTHFR, which half of the population has, that we need more B12 because, again, it goes hand in hand with folate. All right, so the next vitamin that we're going to talk about is B6.
All right, so B6 is another one of those vitamins that actually acts together with B12 and folate. You might be kind of sensing a theme here with our B vitamins, but they all kind of support similar processes in the body. B6 is specifically needed for over 100 enzyme reactions in our body, which are a whole bunch of biological processes that need this vitamin to work properly and keep you healthy. So it's specifically been shown to support your baby's brain development, and it can actually support mental health in moms. So this is a great thing if you suffer from anxiety or depression. Lots of women are deficient in B6, and that can lead to mental health issues. And so getting an active form of B6 is really supportive for mental health. So when we say an active form of B6, we're talking about pyridoxal 5-phosphate, or P5P. You want your prenatal vitamin to contain at least some B6 from this form. And then it may also contain like maybe half the amount from active P5P, and then the rest could be from pyridoxine. So the next one we're going to be talking about is iron.
Iron is an important nutrient for pregnancy because it is an essential mineral that is part of our red blood cells. And our red blood cells are essential to deliver oxygen all around our body, including to the baby. And a lot of women are often deficient in iron because of our menstrual periods. We lose a lot of blood, and the iron is in that blood, and so we have to make sure that we're replenishing that on making sure that we're doing that purposely through our diet or through supplementation. And so oftentimes each person's going to absorb their iron differently depending on their gut health, their stomach health, or even genetics. And so it's important to go to your doctor and get tested, and the best way to do that is through testing ferritin, which is your iron storage. And I like to see my patients ferritin of between 50 and 70 to make sure that they are well prepared for a pregnancy and building up the red blood cells for their baby. And then if it's lower than that or lower than 10, or if you have anemia, you want to do a full iron panel and just make sure they know what's going on. And then your doctor will be able to recommend how much iron that you should be taking. But as far as a prenatal goes, most prenatal supplements do come with iron, but they can come in different forms. And so a lot of times women can't tolerate prenatal vitamins because of the form of iron that is in it. It can make you nauseous, it can cause constipation, and that's totally understandable. Nobody wants that. So there are other types of iron that can be more readily absorbable, and those are going to be iron bisglycinate or iron picolinate. And so if you can find a prenatal with those types of iron, then you're going to be much better off, and you're going to feel a lot better on that particular prenatal supplement. Okay, and the next nutrient that we're going to talk about is zinc.
Okay, so zinc is another essential mineral like iron, and many women are deficient in zinc. Mostly because our dietary intake tends to be a little bit lower, and then also we just aren't eating as many of the foods that include zinc in a standard American diet. So zinc is important for a lot of different things in the body, namely immune system health, making DNA and proteins, and then also growing and maintaining tissues. So it's really important during pregnancy. And then it's also important for egg health. It's a really awesome antioxidant that helps protect the integrity of the DNA in egg cells, and it actually does the same for sperm. So zinc is really great for your partners as well. And then we're actually seeing new studies come out showing that zinc is really important for the maturing process of egg cells. And so if you're deficient at any point during preconception, it can significantly affect fertility. So this is definitely one we want to make sure that you're including in your prenatal vitamin. If you're deficient, some women may need to supplement separately with zinc, but that would be something you would discuss with your doctor. So just like iron, there are different forms of zinc that are more absorbable and available to the body. So the ones you'd want to look for in your prenatal would be either zinc bisglycinate, zinc picolinate, or zinc gluconate. So now that we've talked about all the things that should be in your prenatal vitamin, let's talk about some of the things that shouldn't be in there.
All right, so lower quality prenatal vitamins are going to have additional ingredients that you want to avoid, which are going to be artificial flavors and colorings, preservatives, sugars or additional sweeteners, and
other filler type ingredients.
Yeah, exactly. So you want to be able to provide or to purchase a prenatal supplement that doesn't have a long list of additional ingredients. you want to make sure that you purchase your prenatal vitamin from a reputable company that has high quality standards, because supplements aren't regulated. Sometimes you could just go to a grocery store and buy whatever. You don't actually know what's really in there, and maybe they haven't third party tested it. So another thing is that we don't recommend gummy vitamins, and I know it's a popular choice because they are delicious, but they do contain a lot of sugar, and oftentimes they can't fit in enough of the specific vitamins and minerals that we recommend in the correct dosages. So that's part of the reason there.
If it's a big pink pill, you should probably choose something different.
Yeah.
All right, that's going to do it for today's video. We've given you guys a lot of information for some specific things to look for in your prenatal. Obviously, prenatal is going to include a lot more nutrients than this, but we wanted to make sure we covered some of the most important ones and help you find the correct form and get that quality prenatal into your supplement protocol. So there's a lot more to cover with prenatal supplements. We have a ton more information on prenatals, on specific dosages of the vitamins and minerals that we recommend, as well as the specific brands that we personally recommend to our clients and patients. And all of that information is located in our free course, How to Choose the Best Prenatal Supplements, and the link to that course is in the video description. So if you enjoyed this video today, please like and share and subscribe to our channel, and we'll see you back next week.
Thanks.